Hello everybody. Swine flu is a burning problem at present. Both the parents and doctors are very worried about it. Now we will have a small discussion regarding swine flu with Dr. S. Tangavelu, consultant pediatrician, Dr. Mehta's Children's Hospital, Chennai. Hello sir, good morning.
Good morning.
Sir, what is swine flu?
Swine flu is nothing but a viral fever which was earlier called as influenza. The influenza A is a special virus which it changes its antigenic character frequently. That's why every year it takes a new avatar and comes out with a new strain. So this strain will be little different from the original influenza virus. So it is the antigen are contributed by different species like birds, pig and all. So that's why it's colloquially called as swine flu. But the medical name is H1N1, depending on the antigenic component it bears.
Is it a dreadful disease to be scared of?
Any disease which comes in epidemic is called dreadful diseases. Because this comes in epidemic, affects many children, even adults. That's why it's considered dreadful. But if you see the death rate and mortality is not very high. So I can say very clearly, 100 persons are affected by swine flu. Almost 95 to 98% survive. Only 3 to 4% the chance of the mortality is there. So it's not a dreadful disease. Only that when it presents with complication, it has to be effectively treated.
Now how it spreads? What are the modes of spread for this infection?
It is a droplet spread. When somebody coughs, somebody sneezes, the virus particles spread across. It goes into the atmosphere. Whoever inhales that virus particle, they develop the disease. That is one spread. They call it as droplet infection. Second one is foment by touching. Like for example, the droplet falls over the cell phone or over the book or over some cloth. If somebody comes into contact with it, touches that particular objects, and they touch the nose or eye, nose or mouth, the virus spreads from the droplet, the affected the instrument or devices, from which it goes into the nose of the other individuals. That is second way of spread. So one is when they sneeze or cough, droplet infection. Second is by through the contacts.
What will be the symptoms in this particular infection? Whether if there is a particular symptom, where parent has to be very careful and bring the child and suspect swine.
That's what the most difficult thing. It resembles all the common problem. Like it resembles any other cold cough. Nothing different. If somebody has cold, what they will do? They will sneeze, they will cough, they will complain of fever, body pain and sore throat. These are the exact symptoms of swine flu. Unless we do the lab test, there is no way to differentiate the swine flu from other viral fever and influenza.
What is the test available to diagnose this infection, sir? And if should we have to test all the persons who are having the symptoms?
Good question. The test which is a diagnostic test is called as nasal swab or throat swab, doing RT-PCR. They take the secretions from the nose as well as from the throat. They send it for the test called RT-PCR, which will diagnose the presence of H1N1. But it is not necessary to do for everybody. For the sake of convenience, the patients are divided into three categories. First category is usually called category A. They usually has simple cold and cough, maybe some mild fever. They are not in danger. There is no need to test this and make a lot of panicky for the children, the parents and family members. So generally we don't do any child comes to us with cold, cough and sore throat because it can occur in any other viruses. We don't do it. Second is category B. Category B means the complications are more in children who have asthma, who have some chronic disease like diabetes, or who is taking drugs like steroid. These children are more prone for complications. These children may need. Third category is category C, where they have complications like pneumonia. Sometimes it can affect the brain, sometimes it can affect the liver. If the child comes to the hospital with complications and they need to be kept in pediatric intensive care unit, these children definitely need diagnostic test. To conclude, probably category A comes only with cold cough, may not be necessary. Category B, those who have an underlying disease, which I already explained. And then category C, where they come with complications, these two groups definitely we need to do the test for H1N1.
What is the treatment available for this infection, sir?
Yeah, treatment. There is an antiviral drug called oseltamivir. This is the antiviral oseltamivir. It is available in trade name and different trade names. That is the antiviral drug. Of course, that alone is not the only management. We may have to give paracetamol to control fever. We may have the child has wheezing, we have to give medicine to control wheezing. Or the child develop pneumonia, we may have to put the child antibiotic. Oxygen may be needed. More than all, we have to isolate this case because every time they cough, sneeze, it should not spread to other family members or whoever is staying with them.
How we can prevent this infection, sir?
Yeah, that is a very $1,000,000 question because if we don't prevent the spread, no, it's going to affect hundreds, thousands, and a lot of people. How to this thing is, I will just divide into two. One is a general prevention. Before the disease comes, what is general prevention? After the disease comes, how are you going to prevent the people around you, brothers, sisters, parents, and all? First, we will take how to prevent the contacts, those who are staying with the child, which is already infected. These children, like a child is found to be positive for H1N1, we have to protect the other family members. Like they have to take the same medicine once a day for 10 days. Same medicine which is oseltamivir has to be taken once a day for 10 days. In second is the child has to be kept in a place where you have to switch off the air conditioner. You might ask why you have to switch off the air conditioner. Because the air conditioner means it recirculates the same air inside. So the same virus will be circulating and it will be more detrimental to other people also. So better to switch off the AC and open all the windows so that it gets diluted. That has to be done. And the child has to use a separate kerchief towel. And whoever handling the child should wash their hands. As I told earlier, if they touch the droplet contaminated cloth or table or books, when they touch it, the virus sticks to their fingers, and then if they bring it to the nose, it can spread to the concerned other family members. So this is pure prevention. There are people also to say that absolutely no need to start antiviral drugs also. Probably antiviral drugs, if it is sometime we may even reserve it for those who have an underlying disorder. General prevention is, there are vaccines are available, but there are a lot of vaccines. So without an epidemic, generally, in Western countries they take flu vaccine routinely every year because they are some reason they are prone to develop a lot of complications. In our country, we tolerate viral fever flu better. So once it comes in epidemic, probably before the rainy season, the season in which we expect the swine flu to come, there are vaccines are available. There are two vaccines are available. One is injectable vaccine. Another is nasal vaccine. Through a syringe you have to instill into the nose, that is nasal vaccine. Another is injectable vaccine. These two vaccines are reasonably potent vaccines. So anticipating the epidemic, we can give the children. Particularly, I will advise the children who already have an underlying disease, because they only have more complications. And general precaution is apart from the vaccine. When you think that there is a lot of people affected by H1N1, better to avoid areas where there is overcrowding, malls, cinema theatres, all wherever it is possible, you can restrict taking the children because in about 500 people are assembled in a hall or someplace. Somebody sneezes, somebody has a viral infection, it can spread to others. To avoid getting into contact with them, we can avoid crowded places till the epidemic is over. You might ask whether wearing the mask can protect completely. That is not a very good way of preventing because the mask get sodden or become wet within 90 minutes. You cannot change mask 7 or 8 masks every day. That is not a very 100% protective measure. Avoid handshaking and frequently wash your hands. And third is if you are coming into very close contact with the patient, like the doctors and paramedicals, the doctor and paramedic has to wear a mask called N95 mask before going very close contact. Close contact means looking at the throat, suctioning the throat, taking throat swab and all very close contact. These people should use a gown, gloves as well as a mask called N95. That will prevent them from getting infection from the patients.
What are the complications due to this infection?
Generally, more than 90% they don't have complications. They go like a cold cough only. Only the fear makes us more worried. 90% of the, for example, in this recently we had fortunately Thank God we didn't have much fatal complications. Most of them survived. So complication occur in the form of pneumonia, can affect the heart, can affect the brain. These are the other complications which are expected. But generally complications are relatively less. So people need not get panicky. Only that take some general precautions. If you have any suspicion, go to the doctor. Let the doctor decide whether to do the test or not. Because simple cold cough, we need not do the test. Only when it's necessary, like pneumonia or any other complication, you can do the test. Don't get panic. Even if the fixed H1N1 is affected, nothing to worry. We have enough medication measures to save the child. It is savable and treatable and preventable.
Thank you, sir, for giving such a detailed information regarding swine flu so that people watching, parents who are watching this will be relieved greatly. Thank you, sir.
Thank you.